is that we began 15 years ago in 1999. It was a program within the Office of Health Systems, Research and Innovation of Lehigh Valley. And we're funded by the Dorothy Ryder Pool Healthcare Trust, which has been lovely. They've been funding us for 15 years. They don't fund anybody that long, but they love what we're doing. We have affiliations and partnerships with different clinical departments within our health network. Our health network is very large. It's 3 hospitals. And what we're trying to do is connect with some of the departments within that network, especially departments that are working with patients who are very chronically ill. And then home care, which are patients who recently were in the hospital. Now they've been discharged to go home, but they still need, help at home. So we are working with those departments within the network, and what we're doing through this model is trying to fill those gaps of care, because I'm sure a lot of you are aware, there is a big gap between where the clinical side ends and then what happens at home. And if those gaps of care don't get taken care of, then you either see the patient back in the hospital or you see them having to go to a nursing home where they don't want to be. So this is a way to keep patients at home, improve their quality of life, and keep them healthy and happy. Our mission is using the principle of Time Banks USA. Our mission is to cultivate and sustain a supportive social network based on reciprocity and respect to improve the health and well-being of the community. We are a network of individual members. We have about 700, but probably about 400 active members, clinical partners who you've heard I just mentioned, and service organizations. So I think we have about 33 organizational partners right now in the community that have come together to share skills and services in a non-monetary exchange system. As you all know, time banking. So most actions, decisions, and factors that lead to good health or poor health happen outside of our healthcare facilities. They happen in our homes, neighborhoods, and communities. In 1 year, a person lives over 500,000 minutes. Most doctor visits last 15 minutes. So, you see,
there you go.
You really learn a lot.
Yeah.
The beginning of our time bank actually started. Healthcare trusts usually say, oh, we've got a problem in the community, what are we going to do? How are we going to fix this? So there was a pool of 13 nonprofits that came together, did some research. Time banking was something new, something innovative. Our Lehigh Valley had never heard about it. So it was a great time to introduce a wonderful new model into healthcare. They felt that it was to reduce social isolation within the senior population. So we started doing the UCLA loneliness survey, and realized it wasn't just seniors who were lonely. It was a whole host of other people out there in the community. So, it was great that we learned that. One of the very first exchanges that happened, which just baffled my mind, was a lady needed her light bulbs changed high up in her ceiling. Her doctor told her, don't get up on a ladder, don't climb on a chair, you're at risk for falling, breaking a hip. So he had her to the point she wasn't going to do this. But meanwhile, all her light bulbs were going out in her home. She went through the yellow pages. She called Agency on Aging, doesn't change light bulbs. Contractors don't want to come out unless they're going to pay. You're going to have to pay them to change your light bulb. She had the light bulb, she just didn't have a way to get them changed. By the time she finally reached us, she was just being very persistent, and then I'm not even sure who it was. It might have been somebody in a medical practice said, well, why don't you try the time bank? They might be able to come out and help you. The day we actually connected with her, there was only 1 light left in her house.
Wow.
And it was, it's like, really, is this, how we're supposed to be? So up there is actually, one of our members was diagnosed with ALS. She lives in the historical section of town where you cannot have a ramp on the street. You need the electric lift. Well, she doesn't have money for an electric lift, so our members were really creative and built her a portable, removable ramp. All she wanted to do was come out on her porch and just soak up some vitamin D. That was it. So we were able to get that in place. But those are some of the simple things. Now today, a lot more has come out of it. We have found that we can do simple things like home visits, transportation to and from medical appointments. Run and pick up food. And I think we've heard that a couple times today. Go to the food bank. Pick up food from the food bank. Simple things like that. We also do medical interpreting. So those little gaps in services are the things that we felt were really important in making a difference in some of our patients' lives. We've been able to partner with some really fantastic community organizations. We just got our local blood bank on board. Our members can earn time for donating blood. The blood bank will now be hopefully sharing our information at their blood drives as well. So it's just a great way for us to get a lot more advertising out there. Habitat for Humanity, Ellen had a connection there. It was beautiful.
So that brings us to the neighbor-to-neighbor care teams. This is kind of, like I said, a newer concept that we're really trying to do. Usually our patient-to-member transactions is just, it's one member to one patient. And it might be a few times that member will go visit that patient, or it might just be a one-time deal. You need a ride to this doctor's appointment, I did it for you, done. Or sometimes, we have hospice patients who need a haircut. So we have some members who will go into their house, do a haircut, but that's it. But then we have some more complex patients who, they have a lot more complex care and a lot more needs. And it's not even really for the patient, but maybe for their caretakers. They might need the respite care. They might need, I need someone to come in here and sit with my mother or sit with my brother because I just need to get out of the house and I can't leave them alone. And so what do? And we've come up with this idea called neighbor-to-neighbor care teams where, that's a lot of responsibility just for one member. They can't always do it. I mean, we're all busy. We all have full-time jobs or we're retired. Everybody has a million other things going on in their life. But if we could get a team around this one patient and a team that, lives in close proximity to this one patient, then that patient and that family has that team that they can depend on. Right now, we have 2 care teams running, 3 because Janelle has one too, but Janelle's is a little bit different in the fact that they all kind of take care of each other, and those are all the super utilizers that she works with. But the one care team that I could tell you about is we have a woman who's at end-stage MS. Her husband has been her caretaker for like the last 13 years. They have 6 kids, but they're all adults. They're all out, working and raising families. So it's just been him and her, and they're a very lovely, lovely couple. He's obviously cares about her very, very much, but unfortunately he now has to go to dialysis 3 times a week. So they were fortunate enough to have one of their sons move in from New York City. He now lives with them, but he needs to drive his dad to dialysis, and they don't want to leave the mom alone, while he's driving him and picking him up. So what we were able to do is get 3 of our members to go in Wednesdays and Fridays and sit with her. And all they do is sit with her, they talk to her, they watch movies together. One of them sings, I think they sing to her. I know one of the members does dishes because she thinks, it's 2 guys, they aren't keeping up with the housework as much as she thinks they should be. But they just go in there and provide companionship, and it's been a really wonderful experience for this family. And in an informal way, the family's been giving back too, because this family is very, very talented. There's a comedian in the family. There's the husband's a playwright, so he's been giving acting tips and director tips to one of our members who's been in a couple of the local plays, and so he's been using that. But it's a really wonderful way to see how we have this team of people around this family, and they've really been able to fulfill that need. And it seems like such a simple need, but if you don't have that team, then it can be very stressful. And who needs more stress when you're already going to dialysis 3 times a week? I mean,
this has been a shortened version of this presentation. Click above for the full presentation with more details on how the time bank works and more stories.